Our next session is Making It Count, Realising the Benefits in Your Community. And I would like to welcome our session chair, Dr. Simone Natalu, to the stage to lead us in that. And Sim is the Director of Equity and Communities at Health and Wellbeing Queensland and brings over 20 years of experience in public health, health promotion and chronic disease prevention in a career spanning academic, government and Aboriginal and Torres Strait Islander community-controlled sectors. So, welcome, Sim. I will also mention, just as Sim is going to bring the panel members up, that just an apology, there in the program it mentioned songwoman Marucci to give a welcome to country, but she called in unwell today, so wasn't able to do that. Thank you, Sim.
I thought I was tall until after I have to speak after Matt. Good morning, everybody. It's lovely to be here today to facilitate a panel session on Making It Count, Healthy Food Environments in Action. Today we're here to explore why creating food environments matters, not just in policy papers or in national strategies, but in our day-to-day lives, in our schools, in our workplaces, sporting clubs and other community settings. Whether you're from a remote community, an urban centre or somewhere in between, we all have a stake in shaping environments that make healthy choices the easy choice. We've had a great start from John here, and so I'm delighted to have him on the panel with us again this morning. But can I also now invite our other panel members onto the stage? Firstly, Melinda Hammond, Nutrition and Health Manager at Community Enterprise Queensland, which is a major remote stores group here in northern Queensland. Mel brings deep experience in public health nutrition and is passionate about improving food access and wellbeing in remote communities. Welcome, Mel. Our final panellist is Amanda Watt, who is the Executive Director of Queensland Independent Schools Parents Network. The Queensland Independent School Parents Network represents the voices of over 147,000 parents and leads work to strengthen parents' engagement across independent schools. Welcome, Amanda. So we're fortunate to have their expertise and passion with us here today as we explore why healthy food environments matter so much for our communities. Do I have to stand here, Matt? Do I stay here? Okay. This is a much nicer place to sit. I had breakfast with John this morning, so I feel like we're having breakfast again. And they're all just listening in our conversation. Yes. So to kick off our conversation today, I'd like to start with getting perspective from each of you about why do healthy environments matter so much in the work that you do, and what values or experience have shaped your commitment to this work. So Amanda, would you like to kick us off?
Thank you. Hi, everyone. Look, I think families, like any topic or any issue that we're facing, need to do or find the solutions in partnership. And that usually that's with the school that your child's at, but it's also with the sporting club that your child goes to on the weekend. So parents can do as much as they want at home, but it's when you go out to those places where you've got to make a choice for your child about what they're going to eat. If you don't have a choice, it is going to be the hot chips and the can of Diet Coke. So I guess that partnership piece is what we always push.
Fantastic. Mel?
I've been in public health nutrition for a long time and chipping away at various approaches to try to influence environments and people's diet. And I just see, after many years, that unless you create the space and create the settings to the default setting for healthy, no amount of education and working with groups in trying to change their behaviours is going to get the traction. I just truly believe in environments, and that's what I've pretty much landed towards the tail end of my career, focusing on healthy food environments. It's the place that I feel we can get the most wins.
John, would you like to elaborate on what you talked about earlier?
I think I've spoken a lot. Look, I think from my point of view, it's those champions, and there's a lot of champions within our communities. There's a lot of people who want to make a difference. They just need a little bit of guidance, a little bit of support. They need the resources to help them, and the champions are what makes a difference. I didn't do all that, far from it. As I said, the chef uniform was sort of fake in that photo. The sporting club, the Hylac Hamilton Indoor Aquatic Leisure Centre, the Cavendish Footy Club, that was done by champions. So just support the champions. They're out there. Every sporting club would have one. Every school would have a champion, and which makes a difference.
Great. Amanda, for you, so with that parent lens and obviously in the job that you do you think that provides an opportunity for the parents to be champions?
Look, I think the kids are champions. So I've got 2 boys, one's in year 2 and one's in year 6, 2 different schools. And the kids are very well informed by the school. I think schools mostly do a really great job in educating kids about nutrition and health and all that sort of stuff. And even the peer pressure amongst my year 6 boy and his friends about healthy choices is real. So they do actually, and they pick me up if I'm making something that's not particularly healthy. So I feel quite confident that the kids are doing all right in lots of things. So I look at that quite positively. I had 5 boys over for a year 12 party for my son, a sleepover on the weekend, so I'm still in recovery from that. But I overheard a really interesting phrase they were using, big back. So they were calling each other a big back, as in I think it's a gorilla term, and we don't want to get into, of course, any sort of body shaming or anything like that, but that's what they say to each other is don't be a big back, make a healthy choice is what they're trying to say to each other. So yeah, I think things are going to be okay. I think there's amazing. We've talked about the Stephanie Alexander kitchen garden. One of my youngest child has that at his school, and parents come in and they help with the food prep. There's a teacher dedicated to that, and then we all sit down together around a table and we eat what's been cooked. And amazing recipes come out: potato and leek soup, you know, the old favourites. Dragon fruit sorbet, or Thai salads, all those sorts of amazing meals. And that just then flows on to the conversation at home. Kids are asking to make those recipes at home. So there's lots of great things happening.
Fantastic. So kids absolutely are a great champion. And John, you talked a little bit about this before in your presentation about that snowball and ripple. So children can obviously be a part of that. But what are some of the cues or signs that you've seen in your experience that can give some of us some insight of what to look for?
Oh, what to look for? Look, I think and I was talking about it earlier this morning. Kids have access technology like you wouldn't believe. They're just information machines. So they are switched on. They are looking for. They're calling us out. So we're the ones that need to catch up. And we need to have that healthy option there. So, which I think that's amazing. And you're right. It sort of rings home that, oh yeah, the kids are sort of catching up. They are looking for that. You know, went to the airport and I don't know what AM it was in Melbourne before we shot off was, and my young bloke chose a fruit salad for breakfast. So yeah, I think that's what we leverage off is we can leverage off our kids, and I think we need to make a difference, and we need to support these programs. Stephanie Alexander, we need to make it sustainable. We need those champions within our schools, within our sporting clubs to make that difference.
Fantastic. And how about for you, Mel, in the remote context in which you work in? What are some of the things that you've seen, or has there been other champions in the communities that you serve?
I think in remote settings, you alluded to this, John, that it's we're doing work in very remote settings. The tyranny of distance is massive. So for those who don't know the context, we run 31 retail outlets across far north Queensland in remote Aboriginal and Torres Strait Islander communities, and 27 of them are food stores. And basically our team's role is to morph those food stores to reset the default setting to healthy. So we're tackling that in a range of ways. We're acting on the 4 Ps of marketing, so product, price, promotion and placement, and that's a gradual process. In terms of champions and mobilising effort, in remote settings there are champions in all sorts of places. One of the new areas that I'm discovering in the Torres Strait is the power of churches. So church groups in those settings there are a lot of influential people, not just the leaders of the church, but other people as part of the church. So that's an exciting new area that I had never thought about, and it's that Melanesian culture, and people are very religious in the Torres Strait. So we're exploring that, but there are also leaders in the sporting clubs, in the schools, and that's something that we're trying to tap into and engage them in what we're doing in the store. So not just staying in store, we're working in cross partnerships with other players.
Great. So healthy food environments do reflect what we value in community. So for all of you, what do you believe they say about how we care for people? And we talked about children, but also vulnerable groups. Amanda?
Well, look, I'm just echoing everything that's been said, I think, but families are wanting a healthy choice. I think families are concerned, parents are concerned about obesity rates and all the chronic diseases that come with that. So I think the value is the partnership piece. I think we all need to be singing from the same song sheet with all of this stuff. And as we've said, kids are calling their parents out on unhealthy choices now too. So I think we're all sharing those values.
Mel, did you have a...
Yeah, from an Aboriginal and Torres Strait Islander perspective, the whole reason why our organisation exists, it's under the JLOM Act, so the Aboriginal and Torres Strait Islander Communities Act, and our role as a statutory body is to ensure that Aboriginal and Torres Strait Islander people living in very remote communities in Queensland have a healthy and sustainable lifestyle. And so that's the whole purpose of the entity. So in respect to looking after or doing the right thing by a vulnerable group, and we do know that Aboriginal and Torres Strait Islander people in remote settings have much higher chronic disease rates and challenges with the social determinants of health. But there's so much power in what's already been before. So we're creating a setting that's celebrating we are part of the food system, and Aboriginal and Torres Strait Islander peoples historically had very healthy diets and very healthy lifestyles. So a new campaign that we're going to be running soon, and Health and Wellbeing Queensland is helping us bring that to life. It will be, I'll sneak preview, it'll be called Healthy Ways, Old Ways Are Our Future Ways, and that's about honouring history and the knowledges that already exist and tapping into that. Really a bit controversial, because in retail you rarely use the word old in anything that you're marketing, but we are tapping into that and being brave. But the whole purpose of the entity is to be there to support improvements and meet aspirations of health of Aboriginal and Torres Strait Islander people that are our customers.
Thanks, Mel. John, for you, food in hospitals is often seen as logistics or cost. What helped you see the deeper value in making healthy food more visible and accessible in healthcare settings? So you alluded to a little bit in your presentation.
Yeah.
Is there anything in addition to that?
Yeah, just I guess once again it just made perfect sense to me. It was, I might have had sweat running down my forehead talking to the chief executive, but I could not understand, when I walked into health, and please don't take it the wrong way, how backwards it was, and that's layman's terms. I couldn't believe that the cafeteria was serving what it was serving. I couldn't believe we had no choice. So we have an obligation, and we need to make that significant change. I'm pretty proud 7 years on that, we're not the only health service. Everybody's adopted the healthy choice policy. So we are seeing that ripple effect statewide, if not national-wide, and making a difference, because as I said, we need to make that difference. If health can't do it, then how can we expect other sectors to make the change? So, yeah.
Fantastic. And you shared the story about the chef that made changes to the kids' menu after you had that meeting. Do you have any other anecdotes where you've seen that shift in mindset from the conversations or the meetings that you've had?
Yeah, look, and it's those, I call them small wins, because there are challenges through the project, and we're not saying it's an easy journey, but you've got to celebrate every win. And it's even reaching out to, even Queensland Health. I've done a couple of online sessions recently, and trying to understand remote, and I never really understood remote until I started talking to Queenslanders, because we think we're remote. We're not. So it is. There's those significant stories along the journey that make a huge difference. And I can switch back to that sugar film, Damon Gameau. Yep. That to me was a big impact for me watching that. So I think that was 2014 thereabouts that come out. So it's those sort of movies and that impact that that was reaching our broader communities. So, and basically we needed to make a difference back then. So it's just those little things that along the journey that stick with you, and those the Cavendish Footy Club, man, well done. Like, it's just amazing.
Can I just jump in there? I think schools, and there's outliers of course in every group, but I think school tuck shops are doing great work. Costa's been leading that change for a long time, and I think schools are, for the most part, their canteens are really great. But I think sport clubs really need to get on board with this. I go to lots of sports clubs on the weekend with my kids, and our home canteen is appalling. It's really bad. So a bottle of water is the healthiest you can get. Everything else is deep fried. And we volunteer, parents have to volunteer in the canteen. And I can tell you, as a volunteer parent, chucking the chips into the deep fryer is not as pleasant either. You're saying your staff don't like that either. It just doesn't feel good. And once chips go cold, you realise how bad they actually are, because they've lost all their deliciousness, haven't they? And it's all the fat left behind. So, but there are some sporting clubs that do have fantastic canteens, and I went to one 2 weekends ago. A shout out to, I think it was the Gap Football Club, and they had sourdough bread, and they had sushi, and they had sandwiches. There were still hot chips cooking there, but there was lovely variety, and it was a bit like that picture that you showed before of the green versus the red that I'm used to seeing. So I'd love to see that pick up a bit, and maybe it takes people like me to maybe volunteer and suggest that. Maybe that's what's needed, rather than just observing and being disappointed. Maybe it takes some of that, because of course these clubs are run by volunteers. Yeah.
Absolutely. And that was the next questions, actually, Amanda, were for you around the lead or the influence that parents can have. So you talked about schools, and obviously your role in schools, you have the ability to do that, but you talked about the great work Quast is doing, which we completely agree with. But from a sporting perspective and in your role as a parent, what does that look like? So what are some steps that we all could take to try and influence our sporting clubs?
Yeah, it's challenged me today hearing that, because maybe that's something that I can do, and our friends we can give that feedback to the club and ask what we can do to support them with that, because that stat of the profits going up makes sense. I think if there's a healthy lunch option, perhaps as a family you would stay and you would buy your lunch from there rather than going somewhere where there's something nicer. It makes sense. And just making the amenity, I think, more welcoming as well. If there's lovely tables and chairs out and lights and whatever, you will stay and eat healthier food. So, perhaps I was talking about partnership before, but parents have to play a role in that partnership as well. So, yeah, you've made me think today.
Hopefully I've made everyone else think as well. Thanks so much, Amanda. Mel, for you, how do values like equity, self-determination, cultural connection shape the work of improving access of food into remote communities?
Well, our relationship with community, it's very close and intimate. A lot of people in the remote communities where we operate, we're the only food outlet in many of the locations. and a lot of community members visit multiple times a day. So it's a really important interface with community, but with that comes a lot of responsibility for equity and self-determination. And so engagement with the communities that we run the stores is very important. So one of the things we're working on in the health and the nutrition and health program is to present data on food sales back to community members in a meaningful way. So we're still, with the Health and Wellbeing Queensland, we're developing some reporting systems and dashboards so that we can talk direct to community in each discrete community and discuss not just health statistics but also what people are actually eating. And it is, you know, consumption data. So that's a really exciting chapter to move into, and it's the right thing to do so that the community members we are there to serve get a say in what they're wanting to see in their future. And every time we do have these conversations and present some information and data and other perspectives and share what others have done, like other store groups in Northern Territory, the community members, by and large, most people want a better future for children in their communities, and they're totally on board. And so I guess that's my best response to how we respectfully engage and check that we've got the remit to keep pushing forward in resetting the default to healthy.
Thank you, Mel. So this question is for all of you again. This work that you are all doing can seem slow and invisible. What keeps you going when the change is hard? Where do you find your meaning and motivation? John, we'll start with you.
I don't think I've ever lost motivation, to be honest, and it's as far as it is a challenging journey, and sometimes it is invisible, but that's the importance of reflection. I think it's really important to reflect. Take time, because we don't do it. We generally don't reflect enough. So to reflect back on those small wins, if you reflect on the good times, the wins, it keeps you motivated to keep progressing, to continuously improve, and to remember why you started the journey, and the why. I keep going back to the why. The why was the important part of the journey, and we need to make that significant change. So I think that's the important part for me, is just to keep reflecting. There's always really good news stories. As I said, the exciting part of that second phase where it started, the sporting clubs and schools and whatnot, it's just been an amazing journey. So, and I can feel the sense that you've got some great momentum here in Queensland too. So I think we're going to see some big change in the future for the better.
Thanks, John. Amanda, how about yourself?
Remind me of the question. I remember now. I feel like a bit of an imposter up here talking about food and nutrition, because that is not my specialty. I guess I'm a consumer, and I'm a parent of a consumer, so that's a perspective I bring. Hats off to all of you for the amazing work you're doing. I think I've lost my train of thought now. What was I going to say about that? I was just going to say empathy for families in this piece is probably a piece to address. I think John was alluding to before about the busyness of everyone's busy, and one of the schools that my children is at has this scheme at their school canteen where you can pre-order dinners, healthy home-cooked dinners, and you can, during pickup, pick that up on the way home. Simple things like that perhaps tap into that business of family life. Things that can maybe be profitable for a school as well. Just an idea to throw out there. Yeah.
Thanks, Amanda. Mel, how about for yourself?
I explained before that I'd been in health and as a public health nutritionist for a long time, and this audience, I mean, you're all on board. You're already there, and you understand what the agenda is and what you're trying to achieve, and you've already asked yourself the why. In stepping into a retail setting, it was next level for me. in realising, oh, I'm not the favourite person in the organisation anymore. And you're not a star, you're a troublemaker that's asking people who are experts in their field of selling stuff and they've had a whole career in it, and you're asking them to do something that is, they look at you like you're from a parallel universe, and you're asking them to do something really different. So that gets really tough. I've got a tiny team, and keeping us motivated, my solution to that is stay with the course, get the strategy signed off at the highest levels, ensure the leadership is still really informed and on board, but at the same time, self-care as a professional, I need the networks. And so we have a community of practice across so finding like-minded people in your sector, in other places, is really helpful, I would say. And so we have a community of practice with other store nutritionists across Australia, and we catch up regularly and debrief. It's really important.
And you guys are all doing this for our kids too. That's what we're all here for, whatever the topic is, but especially nutrition. So hats off to all of you, and thank you for everything that you're doing.
Thanks, Amanda. So come on, give us an example of a win, all of you. So when have you had a win? Small, big, in this space, when it's felt really hard?
Me? I've got too
Hopefully
many
they've had a win.
Yeah. Oh, look. I think, and I think I've gone over and over it because there has been so many significant wins. But that, the wins are making a difference, and I think we've, Anna's been on that journey with me over those years. We've seen significant wins along the track, the journey, and they don't end. It's that that link up with Charleville and Roma, I think it was a couple of weeks ago. Just seeing the difference that's happening in those spaces. It's the win of the local country footy club out the sticks that are making a difference to the canteen, and that roll-on effect. It's the school that is making a difference, Stephanie Alexander and the cooking program, to then the next school going, well, why are they so popular? Why are they getting media? Why, and seeing that ripple effect. So that ripple effect, I think the wins are the wins are large. Like they're out there, and the momentum's building. I think you'll see that'll continue, and it'll become easier because it will be the new norm. What we're doing is the new norm. People want it. Our kids, I think that was pretty significant this morning. The kids are actually tech savvy. They're informed. They want the healthy choices. We need to, provide that supply, that demand that they're giving us. Provide that supply. So that's the win. It's exciting times ahead.
Great, John. What about for you, Mel, in terms of what's a win that you've had in your sector and in the work that you do?
I think a win early on was when the board of our organisation decided to invest in a nutrition and health manager. That's how I came to be there. So the board had already decided, right, we're going to tackle this, and they invested using, because we're a not-for-profit, internal surplus funding to dedicate to do good work. That was a win. We had to just have that position reporting direct to CEO with influence to then move things forward. At a more kind of local level, the wins I see all the time are, because nearly 90% of our team members in stores identify as Aboriginal or Torres Strait Islander. So we're a really big employer, over 400 team members, and we are a big employer of Indigenous people. And I see wins every day when our team members engage. We've got an internal, like a Facebook, it's an internal social media. When they're posting on things that we've asked them to do across the store and celebrating the fruit and veg section and being real proud of it and showing photos of themselves, that is what I see as a win, and you've got to call those, and I love them. every day.
Absolutely. Amanda, for you talked about your children calling you out and being the driver. Are there any other examples that you can think of?
Well, it is about the lunchbox prep. So my kids are very honest in their feedback about my lunchboxes. And my youngest, Harvey, who's in year 2, said to me the other day that he wanted a healthier lunchbox. And did we have any carrots that I could cut up? And so I think, the change is here. And you guys are doing amazing work. I think momentum is here and it will override and force people that aren't on board to start thinking this way, especially in those sports canteens. So, yeah, I think the change is happening, thanks to all of you.
Fantastic. Thank you, Amanda. I'm not checking my socials. I just got to look from Matt before to check the app. You've got to work hard to be a moderator. What do we... question here for the panel. What we value has a big impact on what we do. What values do you think we could highlight and talk to that can help win people over? So how do we get the people that might be more resistant to this change on board? Mel?
I can take this one. I've had a recent experience where we brought together all of our store managers and had conversations with them and resetting direction. And there are some people who are resistant to the changes we're trying to make in our sector. And what we did was start the conversation. They thought I would be going straight into, right, I want you to do this, this and this and follow the nutrition policy. Instead, we started with a why question. What's your why in why we're doing this nutrition and health business? And that just completely, we spent quite a bit of time on it in a conversation setting, tapping into people's heart, and they could not admit that it was important for the future of children, for the future of families, for the people that they'd seen pass away or have to leave community because they've developed renal disease that needs treatment elsewhere. Like people, when the store managers started talking about it, they connected. And then we could have another conversation about, the business. Mm.
Yeah, really powerful, Mel. What about for you, John? How have you gotten some of those people that might be more resistant? How did you deal with those 100 or 200 complaints to get them on board?
Why was I so honest? Look, and it is about the why, and that we always go back to the why. Makes it people understand it. It's been a fascinating journey, and when we still have that resistance. So I'm saying it's the new norm, but you still have the criticism of no sugar in the coffee, which is a pretty tough ask. Healthy choices are, to me, green, all green. Would I recommend you going all green? Probably not. Did it make our journey easier? Probably did, because it took the grey out of it. So I think that's why we were so successful to do it in a short time. From my point of view, you get people going to conferences, and there's a plethora of slices and cakes and party pies. It's just that change that we've seen to see. I'm not a food Nazi. The chips and so on are still in the sporting clubs. It's just the choice is now there. So the fruit salad and the access there, or the conference that there's the healthier options are there. Breakfast this morning, how good was that? Healthy options, fresh, healthy. It can be done. So it's just bringing that accessibility to healthy options. It makes a big difference.
What about for you, Amanda? Thanks, John. From a parent, the parent lens that you bring, how do you think you can bring other parents that may not be on board along on the journey?
Well, I don't know that parents aren't really on board. And I think, it's the pressure from kids on the parents is what's going to make the difference, and I think that's already happening. I'm happy to be corrected by anyone if they think parents aren't on board, but I think for the most part we want to see fruit as an option rather than, and those beautiful fruit cups they do in sporting clubs sometimes, it's a better option and the kids will choose that over the chips. It's not, I think banning sugar in coffee is pretty hard line. But if we can just get a bit of diversity in the offering, I think that's huge.
Fantastic. We have come to the end of the session. Matt is giving me the wind up. So I'd like to thank all of our panellists here today for sharing your insights and experiences. Your passion and commitment to creating healthier food environments is truly inspiring. And so as we move though to the rest of the day, I just encourage everyone here to have a think about what the panel has shared and think about the why in all of the other sessions that you will hear throughout the rest of the day. So thank you very much. Please join me in thanking the panel.
Thank you.
Thank you so much, Sim, on leading a very wonderful panel, and for Amanda and Mel and John. Definitely a theme coming through today is there's never been a better time to make a difference, and the momentum is here, as Amanda reminded us on many occasions. So thank you again. That was fantastic. Now, we're going to break for morning tea very shortly, but before we do, we have something special for you before the break. And without much arm twisting at all, we have asked Jade. Jade is going to come. Jade, who is our very own exercise physiologist at Health and Wellbeing Queensland. And I think Jade has friends. She's going to lead us in a short movement break in just a moment. But I'll just mention a couple of things for after 11 o'clock when morning tea ends and then we're back. So in the room we're in now, there will be the Game Changers, Real Stories of Impact in Healthy Food and Drink Provision in School and Community Sport. And in the room next door, over that way to your left, will be Barriers to Breakthroughs Implementing a Better Choice Healthcare and the Pick Me campaign. And I will see you back here for me as the MC after lunch with the 2:15 session where Adam Ferrier will take us through the advertising effect. And I think that's going to be one for everybody of interest to have a look at. Adam is very good at getting things to sell and making people buy. And so if that is of interest to you, make sure that you're here for that session this afternoon. Now, as I introduce Jade, have you got friends? I have friends. Jade has friends. Excellent. So this short movement session before morning tea today is supported by Pod Squad. And Pod Squad is a free play-based app for families. That's a Health and Wellbeing Queensland program that's all about supporting healthy habits in nutrition, movement and sleep. And so you can access more resources like you're going to see from the app and just search Pod Squad and it's a free app. So Jade, please come and lead us through a short movement break and then we'll move out to morning tea. Thank you.
All right, everyone. So I'm Jade and I've been joined here with my colleagues Annie and Lee Keng. We are tasked with getting you moving, getting you up, getting some blood flowing just before we head out for morning tea. So I would encourage you all to stand up, tuck your chairs in, find some free space. You can move around the room. If you're not able to join in, that's fine. You can also join in with the activity from your seat. All right, so in a moment we'll have a video up on the screen, which I'm going to ask you to follow along. You'll also have the three of us standing up on stage, so you're welcome to follow the video or have a look at us as well and join what we're doing. So I would like to introduce you to Coach Geordie from Pod Squad.
Hi, I'm Coach Georgie and I'm a proud bachelor woman. Let's play a game of Would You Rather. I've got some questions for you. First, you've got 5 seconds to pick which fruit you'd rather eat. Now, do the move that goes with your pick for 20 seconds. Question 2. Which fidget toy would you rather play with? Do the move that goes with your pick for 20 seconds. You know what to do. Question 3, would you rather find a slimy lunchbox, a dead cockroach, or stinky socks? It's time to get moving. Try choosing your least favourite options. Until then, keep moving and keep happy.
Thank you, everyone. Now you can join us for morning tea outside.